Well, it's wonderful to be out and about. I'm at Retina Associates here at the River City Marketplace, and I'm just proud to welcome Mansoor Mughal. And I tell you what, we've got a lot to talk about here. You've got a brand new location here, River City Marketplace, a growing business. You've been serving Jacksonville since 1988, and really it's all about the people, okay? And tell us more about the people you serve and more about yourself.
Sure, thank you. Wonderful to be here. But yes, my name is Dr. Mansoor Mughal. I joined Retina Associates about 2 years ago, actually in the depth of the COVID pandemic. So it's been a challenging time for us all. But it's been an absolute pleasure and an honor to be here and to serve the community of Jacksonville. And actually this office that you see here is our newest addition. It's our 5th office.
Yeah, it's beautiful. Very comfortable here as I walked in. So that's important when you're going to the doctor.
Oh, wonderful. No, thank you. And that's what we've tried to do. We've tried to make this as comfortable and as nice an experience as possible.
And learning more about you, so you're actually a retina surgeon and what we call a neuro-ophthalmologist.
Ophthalmologist too.
And there aren't many in Jacksonville, so that's important for folks needing some help.
Absolutely. And you know, it's especially neuro-ophthalmology. Neuro-ophthalmologists, we specialize in essentially diseases of the eye which involve the neurological system as well, which involve the brain and the optic nerve. And yes, it's a very subspecialized field. There's not that many of us here in Jacksonville, so it's wonderful to bring that skill set to the community as well. But predominantly I'm trained as a vitreoretinal surgeon, and that's what I've joined Retina Associates as. But I'm happy to be consultative on any neuro-ophthalmology problems which my colleagues bring to, refer to us for.
And that training's so important, so that helps, does that actually help the patients with their plan, a course of action as to what they're going to do, because you have all the different experience helping them decide what to do?
Absolutely. So when patients often present to us, they've been seen by other physicians, other doctors in the past, and you know, they're very worried about their medical conditions, and we have a wide variety of advanced technology which we can apply, as well as kind of specialized investigative skills which we apply. And in many cases, sometimes we unearth some life-threatening conditions, and we can refer patients appropriately for that. But in many instances, patients are thoroughly investigated. There's nothing particularly serious, and then we can give them that confidence that they need to carry on with their lives worry-free, and also the providers who have referred.
Very good. To it. Yeah, so it's patients, put them first, of course. And who do you actually see? All ages?
Pretty much all ages, from you know, teenagers all the way up through to the elderly. So we particularly specialize at Retina Associates. We specialize in diseases of the retina, and the retina itself is a very small photosensitive structure responsible for vision in the eye, absolutely tiny. You wouldn't think that there would be that many things that can go wrong, but there is a whole plethora of things that can go wrong with the retina. And so that's what we subspecialize in, and pretty much treat all age groups with retinal disease. Very good. And what kind of surgical procedures do you provide for those that need it? So predominantly, the majority of our treatment is actually office-based. So we can use lasers within the office, we can use injections for diseases which up to about 10, 15 years ago, there was literally very little in the way of treatment. So most of the time we can treat and investigate most things within the office. But when it becomes necessary, absolutely, we do proceed to surgery. And the most serious conditions that we treat are retinal detachments, and we expedite surgery as quick as possible for that subcategory of patients. And also, often we're referred patients from other specialists, other doctors, people who have had complex cataract surgery, for example, and there's complications, and we specialize in dealing with those complications, putting in secondary intraocular lens implants if needed. And then also, we also act as a tertiary referral center for patients who have had multiple surgeries elsewhere, and unfortunately have still got retinal detachments or retinal problems. And we tend to apply, you know, we try and apply our surgical skills to those patients too, and hope for a good outcome.
All right. Well, we really appreciate you being on First Coast Living with us today.
It's been wonderful to be here.
Doctor with Retina Associates here. And of course, for much more on this, head to our website, firstcoastliving.net.